Hi, I'm Dr. Tom Macaluso, Medical Director for the Memorial Health Network. Thanks for joining me today for another MHN Quality Chat. It's my pleasure to introduce Dr. Ben Friedman, Chief of Radiology for the Memorial Healthcare System and one of your Board of Directors for MHN.
Thanks, Tom. I'm happy to be here.
Dr. Friedman is here today to discuss one of the efficiency metrics on the Physician Progress Report. As we mentioned last month, the Physician Progress Report is an assessment tool to help drive physician performance and help the network deliver high-quality care at reduced cost. The metric we will be discussing today has the goal of reducing inappropriate imaging in patients who present with low back pain.
According to multiple articles recently published in the radiology and broader medical literature, the early use of imaging in patients with uncomplicated, atraumatic low back pain has been demonstrated to be associated with a higher overall cost of care and potentially poorer patient outcomes.
So clinically speaking, not all patients who present with low back pain are appropriate to receive imaging early on.
That's correct.
So in order for us to achieve this metric, it's important for physicians to understand the evidence-based guidelines for managing patients who present to their office with low back pain.
Right. The optimized workup would include an initial period of conservative management, including rest, the elective use of pain medication, and the use of rehabilitative physical therapy. One facet of the strategy here is to try to eliminate inappropriate imaging in patients with simple muscle strain, who are the vast majority of those who present with uncomplicated low back pain, because those patients don't require aggressive therapeutic intervention. If after a 4-week period of conservative management, the patient's signs and symptoms have persisted or worsened, then imaging may be indicated.
And of course, there are clinical exceptions in which these conservative measures are not indicated.
Absolutely. There are several categories of patients with low back pain who should receive immediate imaging, and these include patients with a history of malignancy, those with a history of recent and significant trauma, patients who are IV drug users, and patients with signs and symptoms of neurologic impairment.
So that last category would be patients who have motor impairment or numbness and pain associated with sciatica.
Right, because those symptoms could indicate the presence of either contact or compression of a nerve root, which would require MRI for more accurate diagnosis.
So the intent of this metric is twofold: to improve quality by driving evidence-based decisions at the point of care, and to improve efficiency by reducing the number of inappropriate X-rays, CAT scans, and MRIs.
This metric is an important cost-saving measure, but it's much more than that. These imaging guidelines are a prime example of how the use of a deliberate, evidence-based diagnostic algorithm can facilitate the better care of patients by providing all physicians, including radiologists, primary care doctors, and orthopedists, with a more disciplined and reliable approach to the diagnosis and management of their patients with low back pain.
Well said, Dr. Friedman, and thanks again for joining us.
It's my pleasure, and if I can add one more thing, I want to invite and encourage all physicians of the Memorial Health Network to contact me personally or any radiologist across the healthcare system to discuss this topic or any other topic related to imaging protocol.
Great. And before we go, I'd like to remind all the physicians in the network to be on the lookout for their first quarter progress reports, which will be delivered sometime later this month. Also, in June, we will be hosting a series of educational lectures to answer questions about the progress report and to discuss the financial distribution model. The dates, times, and locations of these sessions will be published in the upcoming newsletter and on the MHN Physician Portal. We hope you'll join us, and thanks again for watching today.
Thank you.